So what do we do for patients with anemia? Well, we want to monitor their H&H and anticipate a possible transfusion if it gets too low or if there's acute blood loss. And to manage that fatigue, you want to teach them to alternate activity and rest. So for household chores, for example, they might work on one they can do standing, like washing the dishes, and follow it with one they can do seated, like folding the laundry. And of course, you want to identify and treat the underlying cause. And on the NCLEX, this means you need to know which foods to encourage them to eat to address their specific kind of anemia. So there are a ton of food sources that will contain any of these, but these are the ones that the NCLEX likes to focus on. And I like to remember the ones for iron deficiency as the blood and the baby, or red meat and eggs. So red meat is red because it contains blood, and we know that blood is full of iron. And then eggs, that's the baby, is also going to contain a bunch of iron as the building blocks for the blood. And then apart from these, iron can be found in liver and green leafy vegetables, which are just really nutrient-dense foods. So the liver, remember, is the storage organ in the body, so it contains a bunch of iron. But if they don't eat animal products, green leafy vegetables is a good plant-based source of iron. And then B12 is also found in the blood in the baby for the same reason, that's the red meat and eggs, as well as in dairy, which is also meant for the baby. And folate deficiency is not as big of a problem in the US as it used to be because our cereals are now fortified with folate. So if you've ever noticed that your breakfast cereal smells a little bit like a multivitamin, that's why, because it's fortified with folate. And this can also be found in those really nutritious foods of liver and green leafy vegetables. So if you see red meat, eggs, liver, or green leafy vegetables as an option on an anemia item in the NCLEX, there's a safe bet it's going to treat at least one of these types of anemias. But if they can't get enough in from dietary sources, they might need supplementation. So iron deficiency is treated with ferrous sulfate, but this can be really hard for the body to absorb, so we need to teach them to take it correctly. So they'll want to take it between meals with vitamin C, like in orange juice, but not with any milk or antacids, which can impair iron absorption. And you definitely want to warn them about these side effects of black stools and constipation. So black stools would be a warning sign for a GI bleed in a different client, but in these patients taking iron, it's expected. So be sure to warn them so they don't freak out. B12 deficiency is treated with cyanocobalamin, and it's important to remember that lifelong B12 injections are required after gastric bypass. This is because bypass has removed those parietal cells, so they can't produce intrinsic factor to absorb oral B12, and they need to take it by injection. And to prevent folate deficiency, all pregnant clients need to supplement folic acid, like in their prenatal vitamins, to prevent neural tube defects.